and over to Professor Pangsham.
बहुत बहुत आभार सर, आप सभी का IRES आयुष समृद्धि से जुड़ने के लिए बहुत बहुत आभार। अभी हम 1790 व पायदान चढ़ के आए हैं, जिसमें प्रसूति तंत्र और स्त्री रोग के विशेषज्ञों ने अपना आशीर्वाद दिया। अब हम रेबीज केयर एंड क्योर इस विषय में नई चर्चा, नई वेबिनार और नए एपिसोड की शुरुआत करते हैं, जिसका क्रमांक है 1791। वर्ल्ड रेबीज डे के उपलक्ष्य में हम आप सभी का हार्दिक स्वागत करते हैं और अवेयरनेस के लिए ये बहुत जरूरी है कि आज तो हम लोग लावारिस कुत्तों की भी संख्या बढ़ रही है, उनके काटने के इंसिडेंसेस भी बढ़, जितने पिछले 2 साल में नहीं सुने थे उतने हमने केवल 6 महीने में सुन लिए। अभी इतने सारे काट रहे हैं कि हर रोज हम लोग एक न एक विक्टिम को टीवी में देखते हैं। कहीं झुंड बना के काटा जा रहा है, कहीं सिंगल काट काट के परेशान कर दे रहा है। मैं बड़ा आहत हूं इस विषय से और रेबीज डे के विषय में मैं आदरणीय विष्णु प्रसाद शर्मा सर को स्वागत भाषण के लिए सादर आमंत्रित करता हूं।
Namaskar. Good evening to everybody. Hari Om. Respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to AYUSH SAMRIDDHI International webinar series on rabies, care and cure. So in this webinar, we have eminent speaker. I want to welcome Dr. Narendra Dev Sharma from Lucknow. Namaskar, sir, and welcome you to this AYUSH Samriddhi International webinar. Next, I want to welcome Dr. Rajiv V. Goikwad, Professor Veterinary Medicine from Mumbai. Namaskar, sir, and welcome you to this AYUSH Samriddhi International webinar series on rabies, care and cure. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this important webinar on rabies, care and cure. Thank you. Namaskar. Over to Pavanji.
थैंक यू वेरी मच सर। अब संक्षिप्त प्राकथन के लिए आदरणीय अग्निहोत्री सर की मैं प्रार्थना करता हूं, फिर राजीव गायकवाड़ जी जो हमारे मुख्य वक्ता हैं उनके आह्वान की प्रार्थना।
धन्यवाद प्रोफेसर पवन शर्मा जी, बहुत बहुत धन्यवाद। जैसा कि आपने बताया कि हम 1791 पायदान पर आज वर्ल्ड रेबीज डे के बारे में चर्चा करेंगे और प्रकथन के रूप में जैसे आपने कहा कि रेबीज से केयर क्योर वाली बात आती है। बहुत कुछ काम टाउन एरिया में या म्यूनिसिपैलिटी के द्वारा या म्यूनिसिपल कॉर्पोरेशन द्वारा किया जाता है। कई मरतबे कांजी हाउस पकड़ के भी ले जाते हैं, स्पेशली फीमेल्स को, ये डॉगीज को ले जाके ट्यूबेक्टोमी वगैरह करना है, बहुत सी बातें आती है। लेकिन जहाँ तक रेबीज वायरल इन्फेक्शन का सवाल है, वो अगर चार्ज कुत्ते ने नहीं काटा है तो रेबीज का इतना खतरा नहीं रहता है, लेकिन एजाइल होके काटता है वनी में नहीं कि उसको उकसाने पर, स्टिमुलेट करने पर, छेड़ने पर काटता है तो निश्चित रूप से ये चांस रहते हैं कि रेबीज इन्फेक्शन हो गया। और अनफॉर्चुनेट ये है कि कई बार ये 10-10 साल बाद अपना सर्किट कंप्लीट करता है और प्रेसिपिटेट होते हैं इसके सिम्टम्स, जिसमें विशेष रूप से हाइड्रोफोबिया से लेके वही जल संतराश या पानी से डरना शुरू हो जाता है और फिर वो नेक्स्ट टू मैडनेस तक पहुंच जाता है एंड फेटल भी होता है। तो इसलिए बहुत आवश्यक है हम उसके लिए क्या कुछ केयर करें, और यदि इन्फेक्टेड हो जाते तो केयर के लिए क्या है। पहले तो हमारे उत्तराखंड में, यूपी में ही पटवा डांगर में ARV बनती थी, एंटी रेबिक वैक्सीन बनाई जाती थी। पटवा डांगर में, यहाँ पर नैनीताल में। उसके बाद से अब नई जो रेबीज वगैरह आने लगी हैं, ये थोड़ा अच्छी सोफिस्टिकेटेड है, और इनकी बड़ी टाइमिंग और रूलिंग्स है, प्रोटोकॉल है पूरा। इंड्यूरेशन ऑफ स्किन का हुआ कि नहीं हुआ, ब्लड आ रहा है कि नहीं आया, निशान है टीथ के नहीं है, उसी हिसाब से 0, 1, 3, 5, 7, 11 या 30th तक चलते हैं। 5 इंजेक्शन विद हिम, 3 इंजेक्शन विद हिम, लाइक दैट। सो हमारे आज डॉक्टर साहब, डॉक्टर राजीव भारद्वाज जी अपने पूरी जानकारी हम लोगों को देंगे और अवेयर भी कराएंगे। और अगर कोई ऐसा इन्फेक्शन हो जाता है तो लोकल ट्रेडिशनल चीजें लेके कि लाल मिर्च भर दिया या KN4 टच करा दिया या लाइबॉल साबुन से कॉटराइज कर दिया, ये लोकल के अलावा भी अगर पेनिट्रेट हो गया है इन्फेक्शन, तो व्हाट आर द रेमेडीज, व्हाट मे बी द बेस्ट पॉसिबल रेमेडी टू प्रोटेक्ट, and what may be the remedies for the prevention from the rabies. With these words, I again welcome Dr. Rajiv Gaikwad ji for his very distinguished learned presentation. Thank you so much.
Thank you, sir.
थैंक यू सर। राजीव जी नमस्कार।
Yeah, thank you. Today, actually, today is the World Rabies Day. We all are aware about the first vaccine, Pasteur formulated for the rabies, and Pasteur Institute subsequently were established and they were working on rabies. So initially, whatever they have given a post-exposure therapy to the patient, etc., and subsequently the outbreaks were minimized, etc. So that concept of immunology and other thing was established by the Pasteur. So that is one thing we should remember on these days actually. Another main thing will be actually rabies is 100% preventable. But once bite is there, and if confirmed rabies case is there, then it is difficult to stop. Now, in current scenario, hard rabies as such. So here in India, if we see the survey, etc., so majority of the rabies cases occurred through the bite of dogs. So majority population is affected with the dogs. But why dog bite is there? So here there will be the 2-3 things are there. Even we people are also responsible for the multiplication of stray population, etc. So even if generally stray will be population will be increasing around the whatever waste products we are disposing, etc. So that is the one thing. So whenever these wastes are there, so majority of the animals will be around the for their, because they are the scavenging. So they will be roaming around the whatever the wastes are there for food purpose, etc. So this population will be confined to such localities. That is one aspect. Another thing will be the multiplication. Their multiplication is so proliferation, because one female may during breeding season, etc., generally fights amongst the dogs will be quite common. So that's why this propagation of a rabies virus transmission within the population, etc., will be possible. So during a mating season or during a breeding season, the majority transmissions will be there. Another thing, if we see the data of the human dog bites, so nearly 30 to 60% population affected is the children's. Children's will be affected with the dog bite. Why children's are affected? So we should see many times children's are playing actually. So if they are doing suppose uh, running in front of the any dog, etc. So generally some dogs may be having a bad habit, behavioral problem you can say, bad habit of following a person, whoever is running, etc. Or bad habits like chasing.
chasing to the children, chasing to the vehicle, etc. So that may be the bad habit actually. And during such act, they may try to catch. And once catching and force of the children will be forward, and they want to prevent it actually. So during such thing, bite may occur. So that is one aspect. So children exposure is quite common, or comparatively 30 to 60% children may get affected by dog bite. One aspect. Another aspect will be the rest of the population. Suppose human population, if during a late night, etc., they are going through some street, etc., lonely place, etc., if it is there. So generally, dogs may attack during that, because dog is having a natural behavior of controlling their territory. So that is a controlling behavior, you can say, or guarding behavior, you can say, or they may have a arbitrary area markings are there for their area. So that's why when whoever is entering in such demarcated area, because humans are not aware about that particular behavior of the animal. So whoever is entering in that premises, etc. So since their natural guarding and protecting behavior for the particular place, etc., they may attack human population, etc. And during such thing, there may be the bites may arise. So here we have to see the behavior of the animal actually, and at what time you will be entering in their campuses, etc., or their locality, etc. So like suppose in human, if we see bungalow is there, so generally bungalow will be confined with the fences, etc. So in similar way, they will be doing their guarding of a particular area, etc. So encroacher, who is encroacher? Human is encroacher in that area, or animal is encroaching. So that is also one of the important aspects. The another thing will be the whenever the suppose bite is there, so immediately that bite portion should be washed actually under the running water, etc. So that saliva or virus should not adhere to the nervous tissue, and subsequently migration should not happen. And immediately that person or animal, whoever has bitten, so they should take a anti-rabies vaccine. So nowadays tissue culture vaccines are available, so they can take the vaccine. If bite is near the head, then antibodies or immunoglobulins may be required to inoculate, or even immunoglobulin for systemic purpose, immunoglobulin to be infiltrated at the bite site, etc., so that there should not be any minimize the adhesion of the virus to the nervous tissue, and that may be neutralized, etc. So that is another approach. So awareness of human being, awareness of behavior of the animal is important. Awareness of proliferation, how to control this population of the stray animals, etc. So generally, being we are the part and parcel of the environment. We are sharing the same environment. So it is also our duty to control the population of the stray animals. So with the help of either local government, like municipality is there, or corporations are there, they are having a animal birth control program. So animal birth control program should be efficiently implemented. So generally twice in a year, at least 2 cycles will be there, and that will be the one of the breeding time actually. So here, if suppose animal is bred for twice, so minimum 12 to 15 pups will be there, and that multiplication will be faster. So to avoid all these things, population need to be controlled within a reach. And suppose if it is a suppose stray animal within a society, or within your locality, etc. So local people should contribute in such a way that this animal need to be vaccinated. So vaccination of stray animals or free-ranging animals, etc., will be required. So to maintain the herd immunity of within a stray animal, so nearly 75% population need to be vaccinated. Now our government has now rabies is a notifiable disease for human as well as animal. So medical fraternity and veterinary fraternity should come together to fight against the rabies. So for that purpose, now actually whenever suppose some animal is having a rabies, how to identify the rabies in animal? So generally in street animal, if it is there, so there are two common forms are there. So one will be the dumb form and another will be the furious form. Furious form will be so affected animal will be a frenzied, having aggressive behavior, uncontrollable behavior, and many times they may roam on the road. So whoever is come across him, he will bite. So whether it is an animate object or inanimate objects, if if you are throwing some stone, that also will be consumed by the animal. During such act, animal may not understand that whether this is a consumable atom or not. So such type of the behavioral abnormality will be quite common. Animal may consume, may attack, etc. And unless and until that animal stops, he will bite everywhere. So whoever is coming in between, biting will be there. So that's why human population should be, or local people should be aware about the behavior of the animal. And if such animal is there, whatever the things in their hand, etc., they can obstruct their flow or attack, etc. To prevent the bite, etc., will be important. So that is one aspect. Another thing will be the if some animals may show the suppose pet animal is there. So if docile animal is there, all of a sudden become a aggressive. If sudden behavior if it is there, you can suspect a rabies. Or aggressive animal is there, suddenly become a docile. Or some animals may become a sudden paralysis. And generally this paralysis will be from posterior side to the towards the head. So progressive paralysis may occur. But simultaneously, all paralysis cases may not be the rabies one. That need doctor's examination and opinion, etc. about that. Commonest finding will be in animal will be the drop jaw. Drop jaw means mouth will be constantly open, and because of the open jaw, etc., they are unable to drink water or consume any food, etc. So they will be off feed. Tongue will be like a leathery tongue will be there. So leathery appearance of the tongue will be there. And expression, if you see the expression of the animal, so generally vacant look will be there. Vacant look means there is no expression. So facial expression will be lost in such animal. So that will be the one important finding actually. These are the important findings. Everyone should be aware about that. And if such animal is there, so that animal need to be captured immediately. By any means. By any means means if suppose sometimes fire brigade, if nets are available, net can be used to control the animal. You should not handle the animal. Generally, such animal, aggressive animals, etc., they may die within 3 days, maximum up to 14 days, 10 to 14 days may take. So, but generally, virus shedding will be more within 3 days of clinical signs, etc. And once rabid animal is captured, so such animal need to be intimated to the government also through the agencies, local government agencies, etc. about those such animal is in locality under the observation of rabies, etc. For rabies, there is no treatment. Only observations will be there. How the animal take food, how it drinks water, and what is the behavior or reactions are there. So that need to be monitored. And generally, if it is a frank rabies case is there, such animal may die within a short period. So that is one another important thing. The if human bites are there, they should take the advice from the physician, and immediately if such bites are there, they should clean the wound under flowing water. They can use sometimes carbolic soaps can be used. Then such wound should not be covered. Such wound should not be stitched. So that is the important thing. And with the help of their doctor's advice, they can take the immunoglobulins as well as the post-exposure vaccines. So that will be the another aspect. So awareness about the how to handle the wound, how to give this vaccine, how to give the immunoglobulins, etc. need to be aware, followed.
बहुत अच्छा गायकवाड़ साहब, बहुत ही अच्छा। आपने सभी मूलभूत सिद्धांतों, अप्लाइड सिद्धांतों को आपने बहुत ही अच्छा सरल भाषा में सबके लिए रखा। आपका ये वक्तव्य यूट्यूब के दर्शकों के लिए और जूम के डॉक्टरों के लिए, दोनों के लिए उचित रहेगा और सीखने लायक रहेगा। अग्निहोत्री सर, बहुत बहुत आभार गायकवाड़ सर।
Thank you, Professor Pamshonji, and great thanks to Dr. Rajiv Gaikwad ji. Really, you touched all the areas, all the possibilities, all the reasons why the dogs are biting and how it can be managed. The very important point is it should never be covered. It should not be stitched. It should be washed with the running water and carbolized, and try to keep distance. May have a small piece of stick if it is a late hours, night hours, or walking alone, because when they see that they can be restricted to reach the person, then dogs themselves control, and never run on barking dogs, run away, or then they follow and chase them. So it is better to have a stop there, wait for their normalization, or wait for a couple of persons. But even things are happening, and biting of dogs are always noticed to the district hospital, especially when the APR or ARV is not there. They have been made local purchase, and the full course is given. So government is making all efforts to means protect and then make awareness that and sometimes there are a few sufferers of rabies dogs. They are taken away. They are taken away by the municipal corporation if it is noticed by the society, say RDA means personalities, or RDA office bearers. Then government is doing that much also. But at the same time, yeah, as far as the clinical approach is concerned, very naturally we have to have some precautions, some carefulness, and also some management if at all it happens. So thank you so much for your very precious presentation. It will always be helpful for all the viewers.
Small percentage remain. One minute, sir.
Yes, sir.
One, everyone, whoever is the father or mother of the children, etc., they should teach the children. Even during this government has implemented for the awareness. Awareness is important, and vaccination of a street animal is important. So
Yeah.
create the awareness. Even medical doctors can visit nearby schools to teach the children, etc., aware about this behavior and other thing, etc. Veterinarians also, or veterinary college students, etc., they are also visiting many places for the schools, etc. And we are also creating the awareness about the facts, how to avoid the bite. That is important. And any bite of any animal may transmit the rabies. So that is also one of the things. In our country, majority 90% bites are from dogs only. That's why we are saying a dog is transmitting. If suppose some person is entering in suppose wildlife, contact if it is there, so from wildlife also it will be possible. like foxes and other wild animals, etc., carnivores, etc. So that is also possible. So here, that's why awareness about the behavior of the particular animal, locality where they are encroaching, etc., is also important. And nowadays, people are majoritarily involved in mobile on street. So whatever the recently at Kolkata,
Your voice is not coming. Again, there is some
even
net
attack.
problem. Yes.
And subsequently, she ignored, I think, vaccines, etc. But that inquiry is going on actually whether she has undergone the vaccines, etc., or not. And she died actually. So that's why this awareness about how to prevent the bite is important. If bite is preventable, then automatically rabies will be curbed. So in Maharashtra, 29 people died in 7 months. So it is alarming situation actually. So that's why even Andhra Pradesh also there are many cases are reported. So we have to be our approach should to for the prevention, not only cure, but prevention is important than the cure. So if we are able to prevent, it will be a good thing actually. So with this few words, I thank the organizer actually
मेरा
for
तो एक
giving
ही क्वेश्चन है
opportunity.
साहब कि यदि
You
कुत्ता
can
टांग
ask the
पकड़ ले
question.
उस समय क्या किया जाए?
हाँ?
कुत्ता यदि टांग पकड़ ले तो उस समय क्या किया जाए?
Dog पकड़ दिया है.
हाँ,
Tongue.
Hello.
If he holds, catch hold the leg.
हाँ. No, that's why I told no. Whatever in hand, suppose some bag is there, etc. If animal is approaching, that bag can be kept in between to avoid bite actually. So whatever you have in your hand, etc., that is important. If you are running, then animal will follow.
Yes.
So that is one thing. But generally, rabid animal will attack. So that's why whatever the bag, etc., may be there. Because most of the time, someone will be for office, etc., or school, children are there. Some
Yes.
bag, etc., will be within the hand, or bazaar for market, etc. If you are going, even that will also help for this to prevent the bite, etc. So such thing can be used actually, and it can be controlled actually. And immediately,
गुंडों
the animal,
से बचने के लिए ये कहा जाता है कि लड़कियां पेपर स्प्रे रखें, लड़कियां करंट वाला चीज रखें कि कोई गुंडा
वो
अटैक
भी
करे
कर सकते हैं.
तो वो दोनों चीजें उसमें लगा दी जाए. तो ऐसा
No,
कुछ कुत्तों के लिए बनना चाहिए.
नहीं. Current वाला, you
और
have to touch the animal,
और
or some
एलियान हो जाएंगे.
remote like thing should be there, laser type. But that is not possible. Sometimes damage may arise to other people, etc.
ठीक है
So
यार,
such
मेरा
thing cannot
माइक
be done
चालू है, वो
in
ठीक
public.
है.
What I feel that I am also an owner of dogs and doggies for last 20,
Yeah.
25 years. Currently, I am having a Labrador, Golden Retriever. Before that, we were having a Pomeranian. It was a cross one. What I feel that first of all, it is very, very important that when they are in heat, they should be not. They should not be disturbed. There must be a
Yeah.
message to keep distance. At the same time, when the school declare the holiday and the full gush of the flow of students comes out, and if the dog is
Playing.
sleeping, if the dog is sleeping, that anybody's step put over the tail, it reacts like anything, and that is a much more chances
Definitely. True.
to bite. This is one thing. And moreover,
जी
in
सर.
those who
This
are
is a
having a
good
trained
also.
dogs, they are
Yes.
so gentle, they are so means disciplined. Whenever a new person comes as a guest, they just smell and then okay. If the owner is allowing, there is
राइट
no
सर.
question of enmity. This is
जी
very
सर,
important. They are
Yeah,
very
yeah.
disciplined one. So thank you
बहुत
so
अच्छा
much for
लगा,
your kind questions.
Thank you.
बहुत अच्छा
Thank
लगा
you.
सर, बहुत अच्छा लगा. बहुत बहुत आभार.
Thank you.
आप सभी का बहुत बहुत शुक्रिया.
बहुत बहुत आभार. शुक्रिया, धन्यवाद. प्रणाम।
थैंक यू गायकवाड़ सर, थैंक यू वेरी मच। आप जुड़ते हैं तो अच्छा लगता है। अग्निहोत्री सर, अंजना जी,
जी,
निशांत जी, सभी को बहुत बहुत आभार, बहुत बहुत आभार।